I'm back again. Welcome back to our YouTube. I told you that this channel is not just for fashion. Yeah, we do fashion, but it's for everything that concerns us. So you're going to be getting, videos of discussions of things that affect you, things that affect me, things that affect the people that we love. Fashion, of course, we create dresses and we wear it on the human body. So anything that affects our human body, we will discuss here. All right. So today, I want you to remember to subscribe, to like, to comment, to share. Remember, I promised you that top most engaging accounts here, subscribers, will receive gifts from us. We'll contact you and you get that gift. It's a promise. So make sure you always engage, ask questions, comment, and let these videos go viral because there are things that affect us. So for today, there's something that I'm just wondering, and I don't know whether you're also concerned about it, is the level of misdiagnosis that, keep happening in our country, Nigeria. I know that misdiagnosis can happen anywhere. However, something really, is bothering me about how it's happening here, concerning us here in Nigeria. I respect the medical profession. I respect the medical profession so much. It's a very noble profession. It's not everybody that can study medicine, and I can tell you that. It's a profession that takes years of hard work, of study. You need to be kind, you need to be really humane to do medicine because you're dealing with life. You're going to deal with life all through your practice. And I know that at the end of their studies and when they are graduating, I know they take what they call the Hippocratic Oath. The Hippocratic Oath simply says that they will consider life above every other thing. Life above money, life above reward. But the incidences of misdiagnosis have really come to become a worry. I have personal experiences, but what really hit me so bad recently is hearing, stories from people that I know. My personal experiences are 3 times. As a young girl that got married in 2002, when I joined my husband to live with him, I was away from Lagos for a year because I was working as a banker, and then I was transferred out while we were planning our wedding with a promise that when the wedding is scheduled and ready, they will bring me back to Lagos. And because I work for an organization with a soul, and I'm going to say here, Guarantee Trust Bank. It's an organization with a soul. As soon as I wedded, a month after I wedded, I was transferred back to join my husband, to start living as husband and wife. And of course, it's an exciting time. So after the wedding, a month after the wedding, I was, transferred back to Lagos to start living with my husband. And a few months after, I remember I woke up one morning and I couldn't go to work. And I was having these little pains on the right side of my tummy. I didn't know what they were. They were not really pains that you could call pains, but they just come and go. And I didn't know what it was. And of course, naturally, we had to go to the hospital. I went to the hospital and the doctor, I explained what I was passing through, what I was feeling. He said it's appendicitis, and right before me, he called the surgeon. What saved me that day was that the surgeon was not available for that day. It was a Friday, and they booked me for Monday. I come from a home where we had a clinic. My mom is a nurse. To the glory of God, my brother, my family just called my husband like normal brother-in-law thing. How are you guys doing, newly wedded and all that? And my husband was really disturbed. He said, my wife is not feeling well, and they said it's appendicitis, and they booked her for a surgery, an operation on Monday. And my brother was like, no. He called my mom to tell my mom. My husband's aunt called. My husband told her. Her husband overheard the discussion and sent her to my house. My mom called my big sister and said, where are you? Go to her house. And I go home and I met these two big aunties. And they were so calm. What's the problem? And I said, the doctor said it's appendicitis, but I'm not really having that kind of pain, because I've seen my brother when he had appendicitis. The pain was different. But I'm not a medical doctor. These older women saved my life. They took me on a walk without telling me, and then we walked into a laboratory, and they told the man, oh, let's do a malaria test, malaria parasite. But they had already told the man to do pregnancy. I didn't know. And that's how the test results showed that I was pregnant. The doctor didn't do that test, but he already diagnosed appendicitis. Pain was on the right, is it the left side? And he was pressing the right side. So that was a misdiagnosis. Imagine that those older women did not do what they did. Maybe I would have been opened up. My child, my daughter, my first fruit, only God knows what could have happened to her. That adult I have today, that was a careless diagnosis. I tried to remind the doctor that I just started living with my husband a few months before then, but he didn't take that into cognizance. He didn't run any test. He was just after surgery. I know surgery gives more money to hospitals, to doctors, but should it be the first thing? What if I didn't have people that really understood better than me? An unnecessary opening of my body could have happened, and only God knows what could have proceeded from there. My second experience of misdiagnosis, same hospital. I know you say, why did you go back to the hospital? Don't worry, in those days, it's not now that we have HMO. So you have a hospital. When you go to that hospital, that's the hospital you have subscribed to, you registered with. So anytime you go there, there are doctors that will attend to you. I went to this hospital again, and guess what? This time around, it was after I had the child, my first child. I remember having a bout of pain, and after my delivery, I wasn't here in Nigeria, I was in US. And I thought it was the pain of delivery. So because they gave me pain medication, I took the pain medication and it went. So when I got back, I had this pain. It was excruciating. I couldn't go to work. My husband couldn't go to work. So he took me back to the hospital that we go to, same hospital. And guess who was there to attend to me that day? Same doctor. Immediately I saw that doctor. My soul, spirit, body, mind, anything you can consider, I said, no, God, you have to come down and save me. I did not trust him. And true to type, he asked me questions. I was in pain. I was having pain, that felt like it was on my back. I described the pain because I was the patient. I was in excruciating pain. I couldn't even pinpoint where the pain was coming from. So I was at the mercy of the doctor to help diagnose what was wrong with me. This doctor sent me to go and do chest x-ray. I was not having any pain around here. The pain was on my upper abdomen and was feeling on my upper abdomen, radiating to my back. He said I should do chest x-ray. We did the chest x-ray. The result came out. We didn't say, he just wrote. He filled papers and said, oh, you have an enlarged heart. I said, God forbid, I don't have an enlarged heart. And he prescribed medications. Some of them were to be given to me instantly as injections. And you know that injections travel faster than tablets, right? But I refused. I remember that day I was in pain, excruciating pain. I said I will not take any medication written by this doctor. I reminded my husband that's the same doctor that said that my baby, our daughter, was appendicitis. That I do not trust this man. They should call another doctor. I was in pain, visible pain. I was crying, but I refused to take any medication. And that's what saved my life. Again, it was another doctor that walked in. May God bless him. He saw me, he knows me, we know him. He's an OBGYN. He has attended to me during my pregnancy. He asked me, what's wrong with you? I said, please help me, I'm dying. I can still remember the words I spoke. And he took me to his own consulting room and asked me questions. And immediately he could pinpoint what the problem was. and now sent me for the right investigation. When I went for that investigation, that's when what was wrong with me was discovered. I did not have any problem with my heart. I did not have any problem with my chest. The pain was inflammation of the gallbladder. And medically, the only treatment is actually surgery. I was young. I was still having children. But that doctor managed it for me. I was put on pain management on that till I finished having my children. And when it was time to do the surgery, trust me, I ran out of Nigeria to go and do the surgery. Because the option I wanted, as at that time, laparoscopy was not offered in Nigeria. So I had to go to where it's offered. And it's a day surgery there. I didn't want anybody to open me up and suture something that should not be sutured. So that's the second misdiagnosis I've suffered. The third experience of misdiagnosis that we have suffered as a family was my son. My son was just 2 years. I remember coming back from work and meeting my son dehydrated, stooling. A boy that was healthy before I left was stooling. He was vomiting. And we rushed to hospital. We stayed in hospital overnight, until they got him back. And the doctor sent us for CT scan. And we came back, a boy of 2 years plus. You can't enter that machine. So he was sedated. And the next thing we heard was, he has umbilical hernia, whatever. And I read a lot. So I was like, doctor, I know about umbilical hernia, but this one, para-umbilical hernia. I said, this one that you put para in front of it, I don't understand. It was funny, but they told us, it's emergency, they need to operate on him, blah, blah, blah. And this was close to Christmas. They said emergency. I want you to note this word. It was an emergency situation. That's what they told us. But I would let him enjoy his Christmas rice with his siblings. That night, I had to call the family doctor in America and told him, look at what your boy is being diagnosed of. And he laughed. He said, first of all, if it's emergency, you shouldn't have time to call me. If it's emergency, you can't be talking about him eating rice with his siblings. So that already ruled that out. 2, umbilical hernia or para-umbilical hernia is not diagnosed with CT scan. It's a physical eye thing. I'm not a medical doctor. And then he said, bring my boy back quickly and let me look at him. We had to get back into America. And when we got back and he looked at the boy, he was like, who did they say has what? Who did they say is ill? In fact, my son was building snow houses with his siblings. Out there, I had to go and drag him in, like, come, let's see the doctor. There was nothing wrong with him. And the way they practice, he also called other doctors. Everybody, in fact, they made fun, like, who wants to operate on a 2-year-old that has nothing wrong with him? But, of course, I'm a Nigerian mom. And like any other mom, I wasn't going to stop there. I said, no, I need a referral. And then I got a referral to Chicago Children's Hospital, which is huge. I took my son there. When he got to our turn, the doctor was like, so who is sick here? And the boy was playing around with other kids. And the doctor looked at him and like, there's nothing wrong with the boy. I submitted the report and said, no, there's nothing wrong with it. Absolutely nothing. Till today, that boy never was given half or 100, piece, 1/100 of a paracetamol or Tylenol, whichever one you want to call it. There was nothing wrong. That boy would have been opened up for nothing. Misdiagnosis. We respect our doctors. And these doctors, especially this doctor, we love him so much. And we respect him. But it happened. Misdiagnosis. Now, the one that hit me recently is a senior friend of mine, that the husband was ill. This my senior friend was not around because the daughter also had a baby. The husband was ill and had a good daughter and kept submitting himself to the doctor. This man was ill and losing weight, has pain. He was in pain. And doctor kept saying it was ulcer. It was ulcer, the man was losing weight. Losing weight. Until the wife said, no. We need to run tests, get back into London. And by the time the man got into London, guess what? It was cancer. It was already in stage 4. Too late. Eventually, that man died. He passed. Misdiagnosis. I don't know whether ours is different, but I know that in the Western world, medical practice, no one person knows it all. And that is why second opinion, they always seek a second opinion, a third opinion. A second opinion, a third opinion. To be sure that what you are seeing, another person is saying it. But here, in Nigeria, I don't know whether it's a thing of pride. I don't know. I think doctors should just start exploring second opinion. And you have that patient, call in your other colleagues, especially specialists in those fields. We have so many GPs, and it's not a bad thing. But when it has to do with something internal organ, find the right doctor. If it's an endocrinologist, we have them. That part of the body, get a specialist. Let another person also investigate, and then do a lot of investigations. Do the right investigations. Like I was having cholestasis, inflammation of the gallbladder, and then I was sent for chest x-ray. They are not connected. In my layman opinion, and with what my eyes can see, they're not connected. What if I had allowed them to administer those medications that day on me? Maybe my heart would have packed up. Meanwhile, I had no problem with my heart. I really think we need to talk more about the level of misdiagnosis that keep happening in our medical services here in Nigeria. It does not take away from the respect we have for the medical profession. I have people in the medical profession in my family. It's very important that doctors begin to explore second opinion. You don't know it all. Especially in our place here where we have many GPs. We have many GPs. Not every GP is a physician. People graduate, take their stethoscope, open their office, and start treating patients. And they call it a hospital. No. But from my little knowledge, a hospital has all the facilities for the different parts of the human physiology. But a doctor's office can operate and be attached, register with that big hospital so that you can always refer your patients to that hospital. But we know we have doctors' offices here. They are surgeons themselves, they are physicians, they are endocrinologists, they are everything, and it's not possible. That is why in other places people specialize. Here also people specialize. After you have graduated, they go and take the West African College of Surgeons exam, they go and take the primaries, they call it primaries, and then they start doing their primaries towards specialization in their chosen field, and then they become authority in that chosen field. Why not pass those situations to those people that have taken pains to go through these studies and years so that they can also, have an opinion. You can work in a different hospital and seek opinion from doctors in another hospital. The whole essence is to stay true to the Hippocratic oath that you took as a doctor. Life above money. Life above every other thing. A lot of people have passed because of misdiagnosis. I know in my case, God helped me. In my son's case, God helped us. That he provided resources that we could run out. But there are many people that don't have the resources. Many people don't know better. And they submit, because when you meet your doctor, you're submitting your life to your doctor. Dear doctor, we love you, we respect you. But when it's not clear to you, seek a second opinion from a specialist. Refer the case to someone else. And when the patient keeps complaining about the same thing, and you have done everything you think you can do, move it forward to somewhere better. Life has no duplicate. Let's do the much we can as humans to preserve lives. We know that ultimately it's God that preserves life. But let not our negligence take the lives of those we love and those we hate. I love you all. Thank you. Bye.